Now, if you give a drug that's a neuraminidase competitive inhibitor because it's a sialic acid analog, e.g. oseltamivir, zanamivir, you prevent viral spread. If they ever ask you about which drug decreased the probability of viral spread within a community, the answer is oseltamivir or zanamivir. Okay? And sometimes we'll say a patient was treated with a drug for influenza, and cells are packed with virions. Okay? Cells are packed with virions, indicating the viruses can't leave the cell, can't lyse the cell. Okay? So that's a neuraminidase inhibitor. So it'd be oseltamivir or zanamivir. Okay? So antigenic drift, mere point mutations in neuraminidase hemagglutinin causes epidemics within a community. Antigenic shift, pandemics, reassortment of segments. Okay? Now, sometimes they'll ask about which virus can demonstrate genetic modulation analogous to influenza virus, and the answer is rotavirus, because rotavirus has 10 segments. Okay? And you gotta know rotavirus is an RNA virus, a icosahedral nucleocapsid, non-enveloped, double-stranded segmented. Okay? Same with reovirus. So now, we've got our single-stranded negative sense, non-segmented, helical, enveloped RNA viruses. And you've got to know Paramyxoviridae. You've got to know Filoviridae. Okay? And you've got to know Rhabdoviridae. All right? So first I'll discuss Paramyxoviridae. Paramyxoviridae, as I said before, Viridae family, okay, is broken down into paramyxovirus, also known as parainfluenza virus, pneumovirus, P-N-E-U-M-O virus, also known as respiratory syncytial virus, mumps and measles. Okay, so measles, known as morbillivirus, mumps, known as rubella virus, not to be confused with rubyvirus, which is rubella, and rubella is a togaviridae, not a paramyxoviridae. If it's rubella, you know that's an RNA virus, icosahedral nucleocapsid, enveloped, single-stranded positive sense, non-segmented. Okay, and that's togaviridae. Okay, but if it's rubella virus, mumps, okay, or measles, it's paramyxoviridae. That's very important. Okay, now. For paramyxovirus, parainfluenza virus, you need to know that that's associated with CROUP, or croup, okay, C-R-O-U-P, also known as laryngotracheobronchitis. Now, laryngotracheobronchitis is, you're going to see on lateral x-ray what's called a steeple sign, so it's narrowing of the airway. Okay, that's high yield. They like to discuss that in vignettes. Okay, not to be confused with the thumbprint sign, which is epiglottitis, Haemophilus influenza type B. Okay? And these are two important DDX. Why? Because if a patient has CROUP or a patient has epiglottitis, you need to know that both are emergencies. Okay? And you need to know how to treat them. Now, what they will tell you in a vignette for laryngotracheal bronchitis is a seal or bark-like cough. They love that detail. Okay? Seal or bark-like cough. That gives it away. That's your diagnosis. Okay? And the patient will have dyspnea. Dyspnea on presentation. Whereas epiglottitis, imminent dyspnea. So you're ready to intubate. Okay? You're ready, you send the patient to the ICU. It's an emergency. If they ever ask you, what do? You don't send the patient home if you diagnose epiglottitis. Okay? So, respiratory syncytial virus, most common cause of bronchiolitis in children under the age of 18 months. If you ever get a vignette of a child with pneumonia-like symptoms, anything that resembles pneumonia, but then you happen to notice that it's a 1-year-old or a 16-month-old child, answer, RSV. Okay? Now, RSV, there are two important points. One is ribavirin is treatment. They love ribavirin for that. Okay? Ribavirin is treatment. It's an inosine monophosphate dehydrogenase inhibitor. You also use it for hepatitis C, okay? And as we talked about earlier, leflunomide used for rheumatoid arthritis is also an IMP dehydrogenase inhibitor, okay? There's a monoclonal antibody called palivizumab that treats RSV. Now, palivizumab, P-A-L-I-V-I-Z-U-M-A-B, okay? Palivizumab targets F protein of RSV. F protein is necessary for syncytia formation. Syncytia allow the virus particles to spread cell to cell with minimal exposure to the humoral environment. Okay, so what does that mean? If they ask you about a particular viral family that necessitates augmented CD8 plus immunity relative to CD4, you already know viruses are cleared via NK cells, CD8 plus T cells, okay? But if they specifically ask for which virus requires even greater CD8 plus immunity, you know it's a paramyxovirus, or a paramyxoviridae, so paramyxovirus, RSV, measles, mumps, because those can create syncytia, okay, induced by F protein. Palivizumab is a monoclonal antibody against that F protein, okay? Very important for RSV. Now, for mumps, 3 things you need to know. Just POM, parotitis, orchitis, meningitis. Okay? Parotitis, they'll show you a picture of a boy, usually Caucasian, and he'll have bilateral swelling in an inframandibular appearance. Okay? So that's the parotitis, and the orchitis, testicular swelling, and meningitis. Okay? Fairly straightforward. Plus or minus rash. Okay? Rash is not 100% going to be there in the vignette. Okay? For measles, okay, you're going to get your 3 C's, your cough, coryza, conjunctivitis. Okay? So you'll have these cold-like symptoms, your cough, coryza, conjunctivitis, and then you're going to have a transition into the development of these hypopigmented, whitish-bluish buccal lesions. Okay? Intraoral lesions called Koplik spots, K-O-P-L-I-K spots. Okay? The Koplik spots precede the rash, and the rash goes head to toe. Okay? That's measles. If they mention the Koplik spots, they'll show you a picture. Be able to identify the picture. Okay? They like that for some reason. They'll show you a picture. Most students have no idea what they're referring to. Okay? They'll be pointing to a white lesion in the mouth, and you'll have to know that precedes a rash of measles. Okay? And it's more severe than rubella. And as we said before, that's toga viridae. Okay? It's more severe than rubella. And if it's rubella, you're going to know that they'll mention the post-auricular or suboccipital lymphadenopathy. They always mention that for rubella. Okay? Rubella equals 3-day rash equals German measles. Okay? Measles equals rubeola. Okay? Okay? Not to be confused with roseola, which is human herpes virus 6, which is a DNA virus, icosahedral nucleocapsid, enveloped, double-stranded linear. Okay? Not to be confused with human herpes